Hello, this is Dr. Wells with Wells Medicine, and I created this video series to help welcome patients to their ketamine infusion treatments, and especially the initial 6 infusions. In this first video, we're going to review what coming in for your first ketamine infusion looks like, what paperwork we need, what referrals or not we need, and what it looks like to come in for your first appointment, what to bring, what to think about, that sort of thing. When you do come in for your first appointment, we'll have you fill out the quick inventory of depressive symptoms and the childhood trauma quotient quizzes that we talk a little bit more about in our getting ready for your ketamine infusion video. After you've filled those out and paid at the front desk, we'll have you come to one of our warm and welcoming treatment rooms. And then we'll talk to you a little bit about who you are, get to know you a little bit, answer any questions you have about the procedure, and then we'll get started. You'll sit in a very comfy recliner chair and we'll get you hooked up to our monitors. During the infusion itself, we're going to be looking for any rises in blood pressure, rises in heart rate, sometimes a little bit of nausea. We have medicines to treat all of that and to make sure that it's not bothersome. We'll be checking in on you throughout the treatment experience, just giving you a little thumbs up, making sure everything's going okay. And if you need anything in between checkups, you'll have a little doorbell that you can ring to let us know that you're requesting medicine for nausea or you'd like the infusion to speed up or slow down. The medicine is given through a tiny IV drip pump, and that allows us to have the experience be very responsive. If you want to go a little deeper, if you want to stay a little lighter, we can adjust the amount of medication and the flow speed very easily. Once we start the medicine, within 3 to 4 minutes, you should be feeling pretty floaty, a little bit spacey. We'll get your music started, get your eye covers on if you want them and your earphones in, and then we'll cover you up with your nice warm blanket that you bring from home and get started on a relaxing ketamine experience. The infusion goes for about 40 minutes. During that time, we try to keep everything very calm, gentle, relaxing, because the medication can be kind of intense. We're looking for a feeling that is very floaty, very relaxing and somewhat like being intoxicated with 2 or 3 margaritas. That experience does build up over the course of the infusion to around the 30-minute mark where you hear a beep. That beep lets us know you have about 10 minutes left, and it lets you know this is about as floaty and intense as the experience is going to get. Another 10 minutes later, at the 40-minute mark, you'll hear a beep again, and that tells us that the infusion is over. After about 15-20 minutes, the effects of the medication wear off, and you should be able to get up within 20 to 30 minutes, walk out to your ride, and then go have a good rest of your day. During the first infusion, a lot of patients come out of the infusion feeling a little bit lighter or feeling like they've gotten a weight off themselves. Sometimes they say that they can kind of see things again with a little bit more clarity. Those are all very subtle effects, but some people do notice them even after the first infusion. Most of the side effects are contained within the infusion itself, but afterwards you might notice a little bit of a headache because your brain really does run a marathon during the infusion. Sometimes patients feel a little sleepy, and so they might want to take a nap after the first one, but generally that sleepiness gets a little bit easier after each infusion. And we don't recommend taking naps because we want to keep your sleep schedule on schedule. Sometimes patients find that they want to go to work afterwards, which we really don't recommend. We'd like you to have, if possible, the whole day off to help the ketamine experience really be the best possible it can be for you. There aren't really any side effects to look for after the infusion. Just sometimes a little bit of that dull headache and a little bit of sleepiness. After your first infusion, we'll talk about scheduling more infusions. Usually we prefer to have a schedule of infusions that's either 3 the first 2 weeks, or 2 the first 3 weeks, or 1 every week for 6 weeks. But we're very flexible to work with your infusion schedule around all the other things you have going on in your life. Sometimes patients wonder what homework they can do to increase the effectiveness of ketamine. And so with each treatment, we're going to give you a little bit of homework. After your first infusion, we would like you to get some supplements. So the supplements that we advise patients to get are magnesium and zinc, vitamin D, and L-methylfolate. These are talked about in your new patient packet. Oral supplementation has shown in studies of both magnesium and separately zinc to be 30% effective for treatment-resistant depression and anxiety. So this isn't your one Prozac fixes it depression. This has tried multiple SSRIs, SNRIs, other kinds of treatments, and still are suffering from depression and anxiety. So magnesium and zinc, both of them have 30% efficacy, and 30% sounds like it's kind of a small number, but when you look at Paxil or Prozac, they were found to be effective in the 30% range as well. So for psychiatric intervention that you can find at the grocery store, very few side effects, no weight gain, no brain fog, no sexual side effects like the SSRIs and SNRIs, no increased suicidal ideation when you first start the medication like SSRIs and SNRIs, and no nasty withdrawal effects like SSRIs and SNRIs. Both magnesium and zinc generally tend to be very well tolerated when taken, and they're pretty inexpensive to purchase at the grocery store. We're going to be giving you magnesium and zinc during the infusion itself, but we'd also like you to supplement with magnesium and zinc. Even though we're giving you magnesium and zinc, we'd love to give you vitamin D and L-methylfolate, but those don't come as IV preparations. Vitamin D is very important. So most of the patients that we've had go get their vitamin D levels checked have been found to be low or vitamin D deficient. Part of the reason for that is even in subtropical Houston, we spend a lot of time indoors. You really need to have full arms, full legs in the bright sunshine for 15 minutes every day to have good vitamin D levels. So vitamin D is very important for mood, bone health, cardiovascular health. The other supplement that we talk about a lot is L-methylfolate. So there have been great studies coming out showing cerebral folate deficiencies have been found in patients with treatment-resistant depression, and that once those folate deficiencies are fixed with supplementation, those patients see a significant improvement in their mental health. So for all of those reasons, magnesium, zinc, vitamin D, and L-methylfolate have been found to be very effective at increasing patients' moods. A side effect of the magnesium is that it has been shown in studies to decrease suicidal ideation as well, just taking oral magnesium supplements. So we really encourage these supplements. We're going to be following up on any side effects you have from those supplements and making sure that you get the supplements during your next several visits. During the next couple of videos and during the next couple of visits, we're going to talk about whether this dose was right for you, whether it was too strong, too light. So that's something to be thinking about as well after your infusion. We'd really like it to be kind of the golden window between not being bored and being a little too floaty. So we'll talk about that more again next time. I hope these videos are useful in preparation for coming in for ketamine treatments. And if they are, please let us know by liking, subscribing, leaving us some comments. Let us know what would be more useful for you to have information about. And I hope to see you in other videos.